So in this video, we're going to talk about the different training pathways for doctors. So once you've graduated, what routes can you take? So this is something that is again a common question in interviews, but it's quite hard to find the answers. So I'm just going to provide a comprehensive overview of the different pathways. So initially you start as FY1, FY2. So these are mandatory years that you need to do once you've graduated. So during your foundation year 1, you're not a fully qualified doctor. You hold a provisional license, so you can't do things like private practice. If you do any locum shifts, which just means available shifts that you can just pick up, but it's not actually part of your normal rota, you can't locum outside of your own hospital or your own trust. Whereas as a FY2, you hold a full license and you can do your own private practice and you can locum outside of the trust. During your FY1 and FY2, you do 4-month rotations. So throughout the 24 months, you'll have 6 rotations. All that means is you have 4-month placements in different specialties. For example, 4 months of psychiatry, 4 months of A&E, 4 months of cardiology, pediatrics, obs and gynae, etc. Once you've done those 2 years, then you can move on to further training. So it comprises of 3 things. There's GP, which is about 3 years, medical and surgical training, which minimum 6 years for medical, minimum 8 years of surgery, which I'll explain as we're going along what these terms mean. So for GP training, you do your foundations years 1 and 2, then you do 3 years of GP training. Now GP training consists of 3 years, we say GP ST1 to ST2, ST3. So if someone says I'm a GP ST2, all that means is they're in the 2nd year of their GP specialty training. To get into GP specialty training, you sit what's called the MSRA. They used to have interviews as well, but because of COVID, they're not doing interviews at the moment. MSRA is a written exam, which is an MCQ exam style. So once you've done that, or throughout your application process, during the application process, you need to sit that and you apply for your GP training. Once you've done 3 years, you then become a qualified GP. During those 3 years, you are supervised by a qualified GP, and then of course you can then do your own independent practice. And throughout those 3 years, you rotate around different specialties and GP as well. So before, it used to be 18-18, meaning 18 months of those 3 years you do hospital training. The next 18 months you do GP training. Now it's 12-24. So 12 months of hospital training, 24 months in GP. And they do this other thing as when you're doing your GP training in those 24 months, you might have a day or 2 throughout your week that's in another specialty. So it's just to get you more exposure to hospital-based stuff. And that can also include not necessarily doing being actually on the wards in the hospital. It might be you're running clinics within the hospital. So just things that are away from GP but involve hospital specialties. And then you have what's called, they call them gypsies. It just means GP with a special interest. So this is a GP who has done, it's usually about 18 months. After you're a fully qualified GP, you can then do gypsy. You do 18 months in a particular specialty, for example, dermatology. Things like dermatology, once you've done the 18 months, you then become a GP with special interests in dermatology. So you can run clinics or dermatology clinics, and certain specialties carry their own unique purposes. For example, dermatology, you have clinics, but you also have surgical procedures as well. So within the GP, you can run basic surgical procedures if you've done the training for it within those 18 months. For example, removing moles or removing cysts from the scalp. If your special interest is in MSK, which is musculoskeletal, things like arthritis, you can give steroid injections, which normally, if you haven't got that special interest, is not really something that you do. If you have a special interest in gastroenterology, you can do things like scope, so for example cameras through the back passage to look for any potential bowel cancer or colon cancer. Okay, now we have medical training. So medical training is simply anything that doesn't involve surgery. If it involves surgery, then it belongs to the surgeons. Anything other than that, it would involve the medics. Again, you do your 2 years of FY1, FY2, then you do IMT or internal medical training. This is similar to FY1, FY2, where in this case you can have 6-month rotations. You rotate around different specialties for those 3 years. It used to be 2 years, but now it's 3 years. And during that time, you basically have more responsibility than FY1, FY2, but it's more or less doing the same. You're expected to do the same jobs, but you also have a set number of clinics that you need to run. For example, diabetes clinics, you might have to run about 16, for example. I'm not sure on the set number. It'll probably be different depending on which hospital, which trust you go to, but there might be an overall number that is a consensus, but I'm not quite sure on that. Regardless, you need to hit a set number of clinics before you can apply for higher specialty training. Okay. Higher specialty training or specialist registrar. So this is what they'll call you when you're doing your higher special training. They'll call you a registrar. So before the registrar, FY1, FY2 and internal medicine, they would be regarded as junior doctors. And then you become a registrar and then you become a consultant. High specialty training, this is wrong, it should be 3 to 7. So ophthalmology can be 7 years, other specialties can be 3 years. High specialty training is simply training that is very specific to that particular specialty that you're now training in. So if you're a SPR in stroke, so you want to become a stroke consultant eventually, then your whole curriculum throughout those years would be focused around stroke or any pathology dealing with stroke. So your training, your education, any particular accomplishments that you need to achieve, anything that you need to put on your portfolio. So portfolio is like the equivalent of a medical CV. Anything you need to put on your portfolio, it would have to be revolving around stroke, so that when you apply for the consultancy post, you have everything that you need to apply for it. Now, what you can also do is something called run through. Now in high specialty training, usually you can rotate around as well, but typically it's mainly focused around whichever specialty you're in. So for run through, it simply means you go straight into that specialty instead of doing the IMT. So because IMT, you rotate around generic rotations of those 4 to 6 months. In specialty, you don't do that. For example, psychiatry. So not every specialty has this. Certain ones do, like psychiatry, pediatrics, obs and gynae. For psychiatry, 6 years. So you do 3 years of your initial psychiatry, so 3 years, and then you rotate around different psychiatric specialties. They might be adult psychiatry, old age psychiatry, child psychiatry, forensic psychiatry, etc. Once you've done those 3 years, you get allocated to a high specialty training program within psychiatry. So as long as you've passed all the exams that you need to sit within the first 3 years, you'll immediately get put straight onto the high specialty training program for psychiatry, or whichever specialty you're doing your run through in, as opposed to having to reapply. Whereas if you go through the normal route, after those 3 years of IMT, you'd have to reapply to enter high specialty training program. So that would be medical training. Now we move on to surgical training. Again, do your 2 years, and then core surgical is simply 4 to 6 month rotations in different surgical specialties. So that might be vascular, might be urology, could be general surgery, so many different types of surgical specialties. Once you've done your 2 years, again you have your written exams, practical exams, then you apply for high specialty training, which is usually a minimum of 6 years. Then you do your consultancy. So it's pretty much the same thing as medical training, but focused on surgery. And again, you need to have certain competencies, like a minimum number of surgical procedures you'll have to have done to get through from core surgical to higher specialty, and then high specialty to consultancy. You can also do special interests even as a hospital doctor, but it's usually GPs that do it, but you can do it regardless of which specialty. So even if you're a stroke consultant, for example, you can do a special interest in pediatrics. There's also dual training. So for higher specialty training, you don't just have to do specifically in stroke. You can do dual, which would involve 2 different specialties. For example, doing geriatrics. So this is elderly medicine with stroke. So you specialize in both of those areas. So you're a consultant in both of those areas. That's pretty much it. If you have any questions, just leave a comment below, and look for more videos coming soon.